Hi, Year 12. I'm now going to put together the video for LO12, the AO3. So we are now going to evaluate the effectiveness of using CBT to treat depression. Now, I've said this before when we've been evaluating the other treatments, but just a reminder, whenever we're evaluating treatments, we're kind of trying to think of, is this treatment appropriate and is it effective? So does it work? Firstly and foremostly, does it work for people? Is it effective? Does it lead to impact? Does it improve the symptoms? And the appropriateness question considers, like, can it be used by everyone? Are there people who CBT wouldn't be appropriate for? And whenever you can do an evaluation of a therapy, if you can bring it back to those two questions, that always helps improve the quality of your response. The problem though with developing AO3 for therapies is you often find there's lots of studies, so you have to sometimes remember quite a lot of stats. So what we're going to do is we're going to, when there are stats to remember, we'll put them into our titles as much as possible. So I'm going to work through the AO3 as I usually do. I'm going to label them and I'm going to identify whether they are positive, negative or both. So first one in the corner, green. March et al. In 2007 compared the effects of CBT with antidepressant drugs and a combination of the two in 327 adolescents with depression. So 327 adolescents, an adolescent is a teenager / young person, and they're divided into three groups. One who are just having CBT, one who are having drugs, and one who are having both CBT and drugs together. So three different groups. After 36 weeks, so it's quite a long program. After 36 weeks, 81% of the CBT group, 81% of the antidepressant group, and 86% of the CBT plus antidepressants were significantly improved. Now, I think this study shows us a couple of things. Firstly, it shows us all three treatments are effective. So whether you're using drugs, whether you're using CBT, or whether you're using both, all of them work. To get 81% of participants improving with the symptoms is a high percentage of, and it's quite a decent sample size as well, with 327. So I would say the first thing to sort of conclude from that research is all three treatments definitely do work with quite high success rates across all three with a large sample. The second thing I would want to say is that CBT and drugs seem to work as effectively as each other. However, we know that there are problems with drugs that CBT won't have. So, for instance, drugs, once you stop taking the drugs, the symptoms might come back. It could lead to side effects, that people can become dependent on the drugs. None of those sort of negative points are with CBT. So, if CBT and drugs work just as effectively each other, but CBT doesn't have all of those negative side effects, then CBT would be a better treatment program than the drugs on their own. And the other thing to note as well is that if you actually combine drugs and CBT together, you do get an improvement, but would 5% more be classed as a significant enough gain to use those drugs? And that's a question that you could ask. So that first AO3 point is quite a nice chunky AO3. You can get a lot of different sort of conclusions from that and develop your evaluation to quite high level of detail. I am going to, it's a hard one to label. I'm going to label it 327 adolescents. And then I'm going to just put in brackets drugs plus CBT. If you need to put the statistics in, do. Like in your label, if that will help. I mean, something I've always told you, so hopefully you remember, if you're struggling with statistics, try to make it a bit more general. So, over 80% rather than 81% and 86%. And if you can't remember 86%, just say when combining both, it was marginally better rather than remembering the 86%. But it does help with your technical accuracy if you can try to remember some of the statistics as much as possible. Right, the next one, Ellis claimed that his REBT, this is the yellow one now, a 90% success rate, taking an average of 27 sessions to complete. So that's longer than 6 months. So, I mean, the two things I would be known from that, 90% success is quite high. We're basically saying that this treatment is effective and appropriate for most people. However, it's going to take longer than 6 months. It's not a quick fix. This is something that CBT won't have over drugs. If you were to take antidepressant medication, you probably find quite a not instant improvement, but after a few weeks you'd start to feel better. It would work a lot quicker than CBT. So CBT is a longer treatment program. So I think taking 27 sessions to complete it's a 6-month commitment from the client. So I'm gonna label that 90% success / 27 sessions. So 97% success. 90% success, 27 sessions. Okay, next one. In some cases, depression can be so severe the patient struggles to motivate themselves to engage with the hard cognitive work of CBT. They may not even be able to pay attention to what's happening, and they may need antidepressant medication. So what we're saying here is that this treatment won't be appropriate for very severe cases. Remember what we said about CBT? You have to be able to work with your therapist. It's a collaborative approach to treating people. The two people work together. If you are so depressed that you can't leave the house, you can't get yourself dressed, you can't talk to anyone, if your depression is so severe, then how are you going to have that conversation with the therapist? How are you going to be able to do those homework tasks? It takes a lot of effort. It's a huge level of commitment, and you need to be quite motivated. Remember, this is a 6-month program. So it's quite ironic actually, because CBT needs a high level of motivation and a high level of commitment, yet one of the symptoms of CBT is that patients lack motivation. So I would guess that one is, we are asking ourselves, is it appropriate for people who are depressed, who are severely depressed and lack motivation? I'm going to call that one motivation / commitment. Sorry, I've just realised I've not been labelling these as positive or negative. So the first one I'm going to label as clear support and evidence, the 327 adolescents looking at drugs and CBT combined. The second one, I am doing that as amber, so straight face, because even though it's a 90% success rate, it takes a long time. And the third one I am labelling as negative because it's paradoxical, nice word that we could use, paradoxical. Spell that Paradoxical. I'll get you a definition for your books. Seemingly absurd or self-contradictory. It contradicts itself, doesn't it? So CBT has been designed to help people with depression, and it requires a high level of motivation and commitment, yet people who are depressed lack the motivation to commit to the therapy. So that's what I mean by it being paradoxical. It doesn't seem to work. It contradicts itself. So you can put that into your vocabulary books, and it is tier 3, so please highlight that in purple. So I've labelled that one as motivation / commitment, and then I've written paradoxical next, so just to remind myself to use that high level of vocabulary. Moving down onto the second row. Rosenzweig suggested that the differences in effectiveness between different therapies might actually be very small. He says that all therapies share one essential ingredient, the client-patient relationship, and this is what determines the success of the therapy rather than what the type of therapy is. So basically what we're saying is CBT could be anything. As long as you've got a good therapist where you have a good relationship with, then that's what will make it work. I suppose you can sort of relate to that when you think about your teachers in school. You often feel like you're doing better. You get more out of a lesson when you feel like your teacher's more effective. And it's the same with a therapy. It's less the subject, if you like, or the lesson, it's more the teacher. And it's the same with the therapy. It's less what therapy you are doing, and it's more the therapist and the quality of the relationship. Remember what Ella said about that unconditional positive regard that's provided from the therapist, that acceptance of the client no matter what they've said or done, non-judgmental approach is essential. And I guess what we're saying here, it doesn't matter what therapy you are doing. There's lots of different psychological therapies that we can use to treat different problems. It's all about that relationship and how good that therapist is. So suppose that's a negative for CBT, isn't it? Because it's not the CBT that's the determining thing. It's not the CBT that's the critical thing. It's the quality of the therapist and the unconditional positive regard. So I'm going to put therapist, not therapy, as the label. And I'm going to label that as negative. Moving on to the middle one, the orange one. The focus of the CBT is to deal with the faulty thoughts in the here and now. It doesn't deal with the past events and where these thoughts have come from or what may have caused them. Some patients may want to talk about the past and can find that quite frustrating. I mean, there's 2 points to make about this. Firstly, the fact, you might have a client who actually wants, when my husband left me, or when I lost my job, or when these are the kinds of things that I began to think about myself, or think about the world, or think about the future. These are the kinds of irrational beliefs I had, and this is, they might want to talk about the event. And that is not the focus of the therapy. The focus of the therapy is to talk about the thoughts and how to change those thoughts. Now, firstly, that can lead the client to feeling quite frustrated and like they're not getting what they need out of that therapy. But secondly, if you're not dealing with that event, remember what Freud told us about symptom substitution. You might remove these symptoms of depression, but because you haven't dealt with the actual cause of the illness, it could come up as something else, or you may end up with a different problem because you've not tackled the root cause. So I'm going to label that as negative, and I'm going to call it not root cause. And then in brackets, I'm going to put SS for symptom substitution to remind myself that when you don't deal with the cause of a problem and just the symptoms of it, that although you may alleviate the symptoms, they could come back up again in another form. And that's known as symptom substitution. Another study here, Babyak in 2000 studied 156 adult volunteers with depression. They're randomly assigned to a 4-month course of either exercise or drug treatments. Both groups showed improvements, but those in the exercise group had much lower relapse rate 6 months after the therapy ended. Now, this one, you could just say that actually you don't need a therapist, you don't need the time, you don't need the commitment, you don't need the cost of therapy, when you could just assign your client to an exercise program. We know that when people exercise, it releases natural endorphins, those chemicals in the brain which make us feel good, and that could be a natural combater of the depressed mood as opposed to a therapist. So I'm just going to label that as negative and exercise. Yeah, if exercise is just as effective as drugs, and we know that drugs work just as well as CBT, then why do we need CBT? It's a very costly, time-consuming process for both the therapist and the client. So we could just remove it and encourage the client to exercise. Finally, studies such as Linsky et al. Have found that challenging irrational beliefs can significantly reduce depressive symptoms. Proves that the therapy works. So smiley face, and I'm just going to put effective for that last one. It would challenge the irrational belief, then the symptoms work. So as always, go through, write them all up based on my notes in this video, label them as positive or negative, and have your labels nice and clear in your book. Start with your more positive ones first, move through, and so I would be starting with that green one, and then that last pink one by Lipsky. And then I would go to the yellow one by Ellis, and then I would start to unpick some of the problems with depression. Thank you.